Welcome back. Digital Health Assistant Ajuda addresses concerns of how secure, easy-to-use digital storage vault that users can access anywhere, anytime, free of charge. So after COVID-19, pediatrician Dr Liza Street and Taryn Uhlmann, a technology and marketing business executive, came up with a way for mums to have easy access to their children's medical records when it came to their children's developmental milestones, doctor consults and medication names. They join us now in studio to tell us more about this app. Very good morning to you, ladies. Thanks for joining us. Welcome.
Morning. Thank you.
Great
Thanks for having
stuff.
us.
Ajuda, what's this about? And just paint a picture of what it looks like and what some of the core features are.
Sure. Ajuda is a digital health vault. It allows people to upload into a central repository all of their medical records, their medical information, their medical data, their scripts, anything that pertains to looking after their health. So what we found, particularly after COVID, where you weren't able to go into a lot of hospitals or going to see doctors, is that you didn't have all your information on hand. It would sit somewhere else. And if you are immigrating or semigrating or migrating, wherever you are, you don't have all of your information with you, which means one of two things. Either it's very difficult for you to take care of your own health and manage how that looks, and two, for a doctor to be able to care for you holistically because they don't have a full view of actually the medications and the illnesses that you may have had.
So how do you populate the app with the data? Do you go to the particular medical practitioner and request the medical records of the patient?
So we've got 3 phases to this. Currently the vault is available, so if you go to ajuda.co.za, immediately you can go on to the vault, upload any records you may have, and particularly when we talk about moms and parents, often in the cupboard, in a file, very neat, is going to be your vaccine cards and your milestones and doctor's appointments and scripts. What we are saying is, instead of keeping it up on paper in your file, take a photo, upload them, or just if you've got it's already been mailed to you, upload that so you've got it in one central safe place to start. But our next step, and we're busy with that now, is integrating with all the various players, so the health insurances, the hospitals, the various pharmacies and whatnot. So all of that information will just flow into your vault shortly. So that is our first step. Is really, it's there, upload, create an account, and then the second step is that the information will flow automatically in.
Geez, how cool is that? Now, Dr. Liza, how do you ensure that users can access their health data anytime, anywhere, while maintaining the highest standards of safety and security?
Absolutely. So we built this with robust security audits and checks in place. We have data encryption, we have 2-factor authentication. So we made sure, security is our biggest concern. We often believe that whatever is happening in a consultation between a doctor and a patient should remain that privacy between the doctor and the patient. It shouldn't be, there should be no access to anyone else who's not in the room.
So how would you ensure that the doctor-patient privacy is maintained in this particular platform?
Well, in our app, so basically for step 1, you're going to upload that consultation. Whatever the doctor's told you, you can just walk out the room, take a photo of the script, take a photo of the referral letter, and take it with you. Because often what we find in a consultation is, even though we may give you all the information, when you walk out and your child is crying, it's like you may forget what we've told you. And communication is a huge barrier and a problem in healthcare. We want to be able to make sure we communicate effectively with our patient so that they can go out and tell the family what's going on with whoever was sick. So for now, you can just upload it and keep that information because you opened it in cards and you control your app. The next steps, it would be remain between the doctor and the patient, and no one else has access to the app, and that's why we are completely independent of any players within the industry.
Ladies, I'm quite keen to know if this vault will accommodate other applications in the future, like a wearable device, telehealth services, etc.
So the short answer is yes. Our big goal really is that we fundamentally believe that access to your health records and your health information needs to be free and needs to be available. So what we have built right now is a vault that you can access, and you access it. It's at no cost. It's free to the end user. And the second value add that we've got within that is what we call the one-time form. And I'm sure you'll be very aware that when you go to a doctor, you end up filling out all your medical information and your personal information and your healthcare information. The doctor asks you, have you got allergies, family history, and you fill it out over and over and over again. It's the biggest frustration. And so what we've tried to do is to actually say, do it once, fill it out when you're calm and you're clear about what, in your home. And then you just need to send that on and email that to the doctor, or print it out on paper if you prefer for now. But in the future, the technical connection will allow you just to send that via the app. And to that point, there's a lot of different tools and whatnot that are coming out, wearables, telehealth, and many diagnostic tools. AI is very exciting in terms of what it can do.
Yeah.
So this is just the very beginning. The tools and features are coming.
And I would imagine the users of this app, quite from a diverse demographic. And how do you ensure that you make it more user-friendly for everybody to use?
Well, absolutely. I think for us, when we were doing our research, I mean, we started developing this product 3 years ago because we really didn't want to build another medical application that just starts in the App Store.
Yes.
So what we decided was, with all our research, firstly, we needed to build something that was free so that we didn't increase the socioeconomic divide in healthcare. Because most apps, when something comes out, it costs a lot, and then you're only catering for a specific market.
Right.
We wanted to say healthcare should be for everybody.
For everybody.
So that's the first thing we did. And the second thing is, with what you were asking about technology and wearables, AI is here. We can't run away from it. So what we need to do is, as an industry, work together that we are providing our patients with AI that has been tested and experimented and isn't unsafe for them. We need to make sure that we provide them with a platform where they can go on and use AI with responsibly. So when we do bring in those features, we want to make sure that it is good AI. It's health specific AI. Not just you going on any platform, I don't want to say any specific names, and doing it yourself, because that could really lead to problems.
Yeah.
May I add one thing to that?
Sure.
Is just in terms of the ease of use. Two things that we've done that we believe are very different is that when you look at a medical app generally, we find them to be quite scary and intimidating. They're often blue, clipboard.
It is.
So we've tried to take a very different spin. We don't see ours as a corporate app. We see it as a consumer app. And we don't even really like to use the word patient so much because it implies that you're not well. We're there when you're well or sick on your whole spectrum. So we are very visual. We have less copy. It's very easy and intuitive to navigate through the app. And the second step that we are busy with as well is translation. So it needs to be something that is very user-friendly, immaterial of your language base. So our first set of translation is going to be into Zulu.
Okay. Is this a pilot project, or are you at some point going to start charging the patients or the users? I mean, what's your business model for you to implement such a strategy, for free?
So it is free to use currently, and the core product, which is really the vault that allows you to upload all of your health records or pull in your health records, and the one-time form is and shall remain free always. As Liza said, we really believe that access to your health information, it is your right to have access for free.
Okay.
However, in terms of all the other components that you've been mentioning, the technical enhancements, there's a lot of features that really can enhance your experience and engagement with your own health and your family's health and make things better. So we will be bringing in tools and features that will be monetized, or that we will have a structure to, but that will be an opt-in should somebody want to. So we bring lots of value all the time. We'll see, we really want you to be very engaged, but at the end of the day, the core product will remain free. All
right. Ladies, lovely chatting to you. This is such a brilliant initiative. We all need it.
Yes,
we all need
definitely.
it. Great stuff. How do we download it?
You go into Ajuda, ajuda.co.za, and then you just complete the onboarding, and then you're set to go. Just start uploading your records.
Awesome. Great chatting to you. Thank you.
Okay, thank you so much.
All right, pediatrician Dr. Liza Street and Taryn Uhlmann, a technology and marketing business executive, talking to us about digital healthcare storage called Ajuda.